Hello, I'm Dr. Vanita Rattan, and this channel is dedicated to skincare for skin of color. As you know, I'm a doctor, but I'm also a cosmetic formulator specifically for skin of color. You can follow me on Instagram at the Hyperpigmentation Clinic and at Skincare by Dr. V. Right, so today we are talking about period acne or hormonal acne. Acne that basically happens at that time of the month, every month without fail. I feel like the majority of us women are going to know what this feels like. The thing is, I actually manage my own acne, my cyclical acne, because I change my skincare routine every month. And I realize actually most people probably don't know to do this. No one's ever discussed it. It's just something that I worked out and it worked really well for me. So I thought, let me share my experience and hopefully it will help you, because honestly, it's not those spots that happen, once or twice a month. It's the dark marks that are left or the red marks that are left behind. And then you are having to manage those. And then they just sort of layer on top of each other. 6 months in, and it's just pizza forehead is happening. It got to that point for me and I just thought, you know what, I'm done. I need to proactively manage my cyclical change in skin. So if that sounds good to you, please give me a thumbs up. Let's dive right in. So a study was conducted at Mount Sinai Hospital in New York, and it showed that 56% of women had increased acne the week prior to their period. 17% of them had worsening of acne during their period. And period-related acne really does clear up straight after your period has ended. So it really is that week before and maybe, while you're on your period. For me, I usually do it 1 week before plus 3 days while I'm on. And so for me, it's about 10 days of the month that I do this skincare routine. So Dr. V, what exactly is going on with our skin? So just before your period, your estrogen and progesterone levels decline. And so there is a surge of sebum because your sebaceous glands are activated. In addition, there's more inflammation and P. acnes, the bacteria that triggers acne, that takes place in this time as well. The other thing that happens, and is just so prevalent for me, is your serotonin levels drop. And for me, it's just like clockwork. The day before I start my period, the words that come out of my mouth to my husband is, I feel so sad. Like I feel just so sad, like there's no bottom to my sadness. And he just knows, every month he knows. He's like, right, Vanita, I think take tomorrow off, just need a bit of time. He's like, I'll do the work, you just relax. It's so funny because every month I forget that I go through the sad period, mind the pun, but it happens literally without fail. So this stress can also lead to acne. So it is really a cascade of multiple things taking place. So what do you see? There are two different types of acne. Either you've got non-inflammatory acne, those are your blackheads and whiteheads, or you have your inflammatory acne, so things like your pustules and papules. So where does this acne tend to take place? For me, it tends to happen on my cheeks, on my forehead, but often it's the chin, the mouth area, and the jaw. Don't forget, it can take place on the vulva, also because of the friction from your pads. Plus, obviously, you've got hair follicles there, so it can also lead to folliculitis. It's really important that you don't use any wipes with fragrance in that area because it's only going to exacerbate the situation. Okay, so during the acute management phase, when you have a spot and it's red and inflamed, I would want to calm down the inflammation. So I'd use a cold compress because I want to vasoconstrict the area. I don't want to be triggering melanocytes in that area. If it's open top, then I would use a warm compress to try and open up the pore to allow the pus out. That's the acute management. The week before I start my period, I basically change my routine from my usual melasma anti-aging routine to this. So what I do is I wash my face with CeraVe salicylic acid, so CeraVe SA. Then I use 2% salicylic mask from The Ordinary. I leave it on for about 10 minutes and I'll do that a couple of times in the week. Then I'll use 0.5% retinol, or you can also use retinoid from The Ordinary. Azelaic acid I then use to reduce any redness. I continue to use that right through in case I do actually get a spot. And then I top up with Face Theory Moisturiser, the gel-based one. I believe I've put a post up on it on my Instagram at the Hyperpigmentation Clinic. What I'm now starting to do on that Instagram page is put up Dr. V approved products just to make your life easier. Then it's just easy for you to just look down, flick, okay, I'm looking for a moisturiser that's good for oily acne prone skin. Which one does Dr. V recommend? The skin of color, and it's just like a little directory for you, and just make it really simple. Once you break out, you can add in 2.5% benzoyl peroxide. It is quite drying, so be careful if you do have quite dry skin, but I would literally just spot treat it if once you actually get a spot. What I tend to do is I write down in my diary when my period is due so that I can work backwards, and 7 days before I can switch my routine to this. Can you please write down below if this is something that affects you and you get period related acne too, and how you cope with it, because I think it'd be really helpful for all of us. And if any of you also go through the same like sadness that I go through just the day before like clockwork, that would also be nice to see. I'm not the only human out there going through this. Please don't forget to, I'm in the comment section for 1 hour at the launch of every single video. So please don't forget to ask me your questions then. So make sure you hit that notification bell. You can follow me on Instagram and on TikTok, which is Dr. Vanita Rattan. Thank you very much for watching.